Good morning. I'm Henry Lively, Administrator of Health Services here, and I'm honored today to welcome guests to Bethany Village Senior Living Community. First, we have the Department of Health's Executive Deputy Secretary, Keara Klinepeter. We also have Margaret Barajas, the State Long-Term Care Ombudsman. And we have Ann Henry, Vice President and Government Affairs Officer with Leading Age Pennsylvania. Before we begin, I have to say how grateful we are to the Department of Health for its continued partnership and guidance throughout this pandemic, as we all work together to do our very best to keep seniors and those who care for them safe, and ultimately to save lives. So it's now a distinct honor to welcome Executive Deputy Secretary Ms. Keara Klinepeter.
Good morning. Thank you, Henry, for having us here today at your beautiful facility. I really appreciate Ann Henry from Leading Age PA joining us, as well as our State Long-Term Care Ombudsman, Margaret Barajas. Over the past 17 months, COVID-19 has been impacting communities across Pennsylvania, the country, and world. When the COVID-19 vaccines became available, we made it a priority to vaccinate our most vulnerable Pennsylvanians first. Those were our residents in skilled nursing facilities and people 65 and older. We also made it a priority to get staff working these facilities, those taking care of our loved ones, vaccinated. The early acceptance of the vaccine was high among residents in skilled nursing facilities. And among staff, there was strong initial interest, but the current average staff vaccination rate is only 59.9%. We are still facing COVID-19 today. In fact, cases in Pennsylvania are increasing. Yesterday, we reported more than 1,800 new cases of COVID-19, over 800 hospitalizations, and tragically 22 deaths. These are all preventable because we have 3 safe and effective vaccines. The highly transmissible Delta variant is spreading across the country and across Pennsylvania. That is why now more than ever, we need to get nursing home staff vaccinated to protect themselves, residents, and the community from COVID-19. As COVID-19 cases are rising, the Department of Health is firmly committed to preventing outbreaks by stopping COVID-19 from entering nursing homes in the first place. We know that one of the best ways we can do this is by vaccinating staff in these homes. We've been reviewing self-reported vaccination data that homes are required to submit to the federal government. We identified facilities with the lowest vaccination rates. We then reached out directly to the bottom 30 facilities in July to emphasize that the COVID-19 vaccine is the most effective measure that can be taken to prevent disease in their facilities. We then reached out to all of the facilities that have a staff vaccination rate below 50% to first understand the cause of their low rates, and second, provide assistance in educating and encouraging the staff to get vaccinated. We provided educational resources to the facilities over the course of the vaccine rollout, and we did so again just last week. Even with all of this, vaccination rates among nursing home staff are still too low in most facilities. This is why we are setting forth the expectation that all nursing homes have at least 80% of their staff vaccinated by October 1st. This is a public health issue, and these measures are needed to protect our most vulnerable Pennsylvanians. While we know that this expectation is aggressive, we also know it is achievable. COVID-19 is again threatening the lives of our loved ones in nursing homes, and getting vaccinated is the most effective measure to prevent the spread of COVID-19 and ensure the health and safety of residents, staff, and the community. Currently in Pennsylvania, only 12.5% of facilities have a vaccination rate of 80% or greater. This is embarrassing and, quite frankly, very frightening to residents and their loved ones. We are committed to helping prevent outbreaks by stopping COVID-19 from entering a nursing home in the first place And one of the best ways we can do this is by vaccinating staff in these facilities. It is a public health problem that requires everyone to take action and get involved. We need every Pennsylvanian who has a loved one living or a loved one working in these facilities to encourage staff who have not yet been vaccinated to do so now. They don't have to do it for themselves. They need to do it for the residents they serve and their loved ones. We cannot stress enough how important getting at least 80% of staff in all of Pennsylvania's nursing homes vaccinated is. Literally, the lives of our most vulnerable are at risk, and as we have seen in the past, outbreaks of COVID cases in unvaccinated people happen. We do not want an unvaccinated person bringing the virus into the facility. For facilities that do not meet the 80% expectation by October 1st, the department will require them to increase testing frequency for unvaccinated employees. The department will support some testing for facilities through a federal grant who do meet this expectation. But for those who do not, department-funded surveillance testing will not be supported. In addition, the department has been and will continue to work with facilities that may not be testing at the Centers for Medicare and Medicaid Services required frequency. Appropriate regulatory action will be taken if facilities are not compliant with the testing requirements. These vaccination and testing strategies are intended to first, increase the rate of vaccination among staff, second, ensure testing is happening frequently in areas where vaccination is low and transmission is high, and third, improve transparency for the public on vaccination rates in skilled nursing facilities. I would very much like to commend the skilled nursing facilities that have already exceeded this 80% threshold. To increase transparency for the public today, we are launching a new skilled nursing facility vaccine dashboard to clearly provide the vaccination rates for staff and residents at all nursing homes in the Commonwealth. These data that the nursing homes are already required to report to the federal government weekly, we're simply making them in a more easy to understand format on our website. We are launching this new dashboard to make vaccine data more available to the public. We want families to see the vaccination rates where their loved ones are living and working. And honestly, if you don't like what you see, we encourage you to contact the facility where your loved one is living and encourage them to take the steps necessary to increase vaccination rates and keep COVID-19 out. We've seen several organizations, facilities, and states implement similar vaccine expectations for nursing home staff, including leading age PA. We have the tools to stop the virus from spreading. The Department of Health remains committed to protecting those who have been working on the front lines of this pandemic and will continue to ensure that our most vulnerable Pennsylvanians are safe. Getting vaccinated is still the best tool we have to fight this virus and its variants. While we have made great progress in getting Pennsylvania vaccinated, our work is not done. We must take steps to protect ourselves and those around us, especially our most vulnerable residents from COVID-19. And now I would like to introduce Ann Henry from Leading Age PA, a statewide association for long-term care facilities.
Thank you, Keara. I'm pleased to be here today and to stand with the Department of Health to encourage nursing facility staff to get the COVID-19 vaccine. Leading Age PA, the association leading the senior services industry and representing more than 380 nonprofit long-term care facilities across Pennsylvania, makes the safety and care of all residents and staff in member communities our top priority. Since the coronavirus pandemic swept across the globe in March of 2020, long-term care facilities have been at the epicenter of the fight against a virus most dangerous to those we serve. Throughout this crisis, we have fought hard for the resources and supports needed in older adult congregate settings and continue to do so. We know the fight is not over. As a matter of fact, we're hearing every day of more breakthrough cases of COVID-19 in vaccinated residents that can be traced to unvaccinated staff. This doesn't only affect the residents that have been exposed, but may close a portion or an entire facility to visitors. Our long-term care residents went without visits from families and friends for about a year due to a federal mandate. This was devastating for them. They were so grateful to have visitors again, but one COVID case of an unvaccinated staff member can cause visitation to shut down for several weeks. This is unfair to the residents and to the staff who are already vaccinated. On behalf of Leading HPA, I urge all healthcare and aging services staff to get vaccinated. Not only the staff working in nursing homes, but also the staff in personal care homes, assisted living residences, retirement communities, and those providing services in home and community-based settings. Any individuals that are providing care and services to Pennsylvania's aging adults. Not only have vaccines been proven safe and effective against a pandemic that has plagued and targeted our aging adults for nearly 18 months, but they also reduce the risk of spreading the virus while saving lives. Leading HPA, along with the Department of Health, wants to help increase the rate of vaccination of long-term care staff. We know the vaccine works. The numbers show that when residents received the vaccine when it first became available at the end of December, cases of illness and death plummeted. Increasing the vaccination rate in our long-term care staff will help to keep those numbers low. Mandatory vaccinations as a condition of employment in long-term care facilities have increased in Pennsylvania because their staff are providing daily direct care services to those most vulnerable to the coronavirus. We know these are difficult decisions for long-term care providers to make. We know that we are in the worst staffing crisis of our time, but that losing even one staff member who refuses vaccine will be one position that will be incredibly difficult to fill. But isn't the health and safety of our residents worth getting the shot? For all of these reasons, Leading HPA not only stands with the Department of Health in encouraging staff to get vaccinated, but we encourage our members and all healthcare organizations to consider mandating vaccination for staff. We support our members and all long-term care providers as they make decisions with respect to vaccine mandates, with the safety and care of all members of their community at the core. All leaders should be respected for making the best possible choices for their communities at this time, given their mission, their residents, and their staff. Leading HPA is committed to providing our members with the resources and information they need to educate staff and community members about the efficacy and safety of the COVID-19 vaccine. In addition, we encourage everyone, every individual, to make responsible decisions with compassion for the safety and care of all. I thank you today for allowing me to be here and share these comments. Henry?
Thank you, Ann. This has been indeed a very challenging year for all senior living communities, and we've faced those challenges together. I'd like to say how grateful that I am to the team here at Bethany Village, including residents, family members, and our associates. They've been so outstanding and worked tirelessly to create an outstanding safety record throughout the pandemic. Looking back last year at this time, we were eagerly awaiting on the horizon the possibility, and we were full of hope for the COVID-19 vaccine. It has become one of the most important tools we have to protect each other and our residents, and I'm proud to share to date that 99% of Bethany Village residents are indeed vaccinated, along with 75% of our associates. Now, as part of the Asbury Community System, Bethany Village has joined a growing list of aging services providers who are indeed requiring associates to be vaccinated against COVID-19. Doing everything we can to make this a safe and rewarding place to live and work is our highest priority. And it certainly takes a strong team to do that. Most importantly, the caring hands of CNAs, LPNs, RNs, along with dedicated housekeeping, dining, and environmental services staff, all staying strong together. Since COVID began, we have conducted more than 9,000 tests in accordance with CMS and state guidelines. To date, our positivity rate is just 0.5% compared to 7.5% nationally. I have some team members watching from the porch over there, but I'd like to recognize two of them here with me in our ongoing safety effort. I'd like to ask them to stand, please. Ms. Deborah Dunn, Bethany Village's infection preventionist, and also Dr. Namrata Halderper, who is our longtime medical director here at Bethany Village. Thank you, ladies. Thank you both for your expertise and your decisive actions that kept residents and associates, our caregivers, safely in the boat during this storm. We are very grateful to you and others like you for your dedication to supporting the best for Pennsylvania's senior living and long-term care communities throughout this pandemic. Thank you all. I am now pleased to welcome Margaret Barajas, the State Long-Term Care Ombudsman. Margaret.
Good morning. Long-term care ombudsmen, not just in Pennsylvania, but across the nation, work to resolve problems related to the health, safety, welfare, and rights of individuals who live in long-term care facilities, including nursing homes. We also promote policies and consumer protections to improve long-term care supports and services at the facility, local, state, and national levels. On behalf of the 80,000 souls who live in skilled nursing facilities across the Commonwealth, who we collectively serve, and this may be a first that we have a position on an issue for which advocates like myself, the regulatory entity Department of Health, and Leading Age, the Provider Association, come to agreement. You know it's the right thing to do. Thank you for launching this campaign, and thank you for promoting it. We know now that nursing home residents are among the most vulnerable to the virus. They're already medically fragile, and well, they live in a group setting. Until the vaccine became available, the only plan of protection for them was wearing a mask at all times and remaining in their rooms, isolated, socially cut off from friends, loved ones, and the outside world. Within the walls of their homes, recreational activities, hair services, and even meals in the dining room with friends were stopped. I've been told too many times to count, I'd rather die of COVID than live one more day in isolation in my room. When the vaccines became available, most residents couldn't get in line fast enough to get those shots into their arms. Their loved ones, desperate to do anything to see their mothers, their fathers, their husbands and wives, and in some cases, they drove for hours to find a vaccination clinic. And still today, many skilled nursing facilities are incredibly restrictive with visitation because they are either undergoing outbreak testing or because they fear that visitors, or in some cases, even long-term care ombudsmen on official duty, will reintroduce the virus and shut the whole home down again. Because of these cycles, many nursing home residents find themselves in a seemingly endless loop, already referred to, a loop of quarantining and testing that removes any opportunity for them to go outside with friends or, to be honest, live and enjoy life. So what's being launched here today is indeed a campaign of hope. Hope that together we can protect our nursing home residents using all of the tools at our disposal. Hope that we can bring hugs back in style. and hope that life in skilled nursing can get back to normal as quickly as possible. Nursing home residents and their loved ones have been asking for this, and today, the Commonwealth of Pennsylvania and the industry that serves these consumers has responded. Thank you. And with that, I would like to introduce Executive Deputy Secretary Keara Klinepeter.
Well, thank you, Anne, Henry, and Margaret. Those were all extraordinarily poignant and important remarks. We're pleased to answer any questions you have. I can't quite hear you.
Why not a mandate something along the lines of what the state just announced with the state facilities?
So we actually really prefer to try to work in collaboration with the facilities, and this is actually very similar to what we announced for Commonwealth employees. What we're announcing here today is that we are expecting that facilities will get up to 80% of staff vaccinated, and that then if they aren't able to reach that metric, they will have to do additional testing.
And what, and as you explained, they have to do additional testing, which has a cost, and that cost is on them. I mean, it sounds like that's supposed to be, is that somewhat of a punishment, or is that an incentive? And also, could you mentioned regulatory actions. What I'm trying to make sure I fully understand is, what is the cost and penalty to those that don't meet this goal?
So those who don't meet the 80% expectation by October 1st are going to have to increase testing at a level that we will determine based on community transmission closer to the date. And they will have to bear the cost for that surveillance testing. The department has received an extensive amount of grant funding, and we are going to put some of that grant funding towards financially supporting facilities and doing what we call surveillance testing who have met that 80% threshold. The regulatory action that is can be taken is if facilities are not in compliance with CMS testing requirements. So right now, if a facility is located in a county that has less than 5% positivity, they have to test once a month. If the county is between 5 and 10%, they have to test once a week. And if it's 2 times or more, they actually have to test, if it's 15% or more, they have to test twice a week. And so if a facility is not doing that level of testing, then the department can take regulatory action against the facility by issuing a deficiency. The facility has to come up with a plan of correction, and then we ensure that they have made that correction. Other questions? So if facilities aren't meeting the CMS testing requirement for skilled nursing facilities, they could be issued a deficiency. That deficiency would be posted on our website. Everyone can see it, along with the plan of correction that the facility would have to put in place. And then we follow up to make sure that they have met that or implemented that plan of correction. There can be fines associated depending on the level of severity with that deficiency. Well, since we know that 12.5% of facilities have already met the goal, we absolutely do feel it's achievable. And fundamentally, there are lives on the line. And so even if this is challenging for facilities, we absolutely have the expectation that they do the right thing and get people vaccinated to save the lives of the most vulnerable.
You talked a little bit earlier about having made some preliminary discussions with facilities that had no vaccinations.
Yeah.
Why are we able to have this? Why is it that
Well, I'm certainly open to hearing from Henry, although his team has done an extraordinary job. But I think what we hear from staff in the facilities are similar concerns that others, more general population have. So there are concerns about side effects. There are concerns about fertility. And we know that there are good factual education materials that can correct the record on a number of these concerns. That's why we continue to send those educational materials to the facilities, and we strongly encourage them to make those available to their staff. But more than that, the staff who have been vaccinated in the facilities, we know that peer-to-peer conversation is often the most effective thing in getting people vaccinated. And so it's the amazing clinicians and infection control preventionists who are able to have that knowledgeable conversation with their teammates and be able to say, this is why you need to get the vaccine, and address their concerns.
With the Delta variant becoming more common in our communities, I know that you said some facilities are already considering closing or kind of isolating their residents again. Do you see this being a statewide thing potentially in the next month or coming months?
So right now, facilities are required to do testing and in some instances isolation and stop visitation when there is an outbreak. That's a federal requirement that's actually been in place for almost a year now. I can't speak for the federal government, but the Commonwealth is abiding by federal guidance.
Is a mandate much of a possibility if these goals aren't met?
This is a first step, and we're excited to see the facilities hopefully meet the expectation. We'll see where we go from there.
There's a lot of nursing homes in Pennsylvania are having a real hard time getting enough workers, and they're losing workers to other industries that are raising pay to deal with their own worker shortage. Is that, to what extent does the fear that nursing homes would lose too many workers if there was a mandate? I mean, did that figure into the decision?
So absolutely, staff shortages are a concern. And I think that's why we're opting to try to work collaboratively with the facilities first, as opposed to mandating it. I think that this is, though, a step, and fundamentally we believe that we need more than 80% to be vaccinated. 80% is a minimum, right? It's not a ceiling. And so our hope is that with this renewed effort, with hopefully families and advocates, being empowered with the information of how many people have been vaccinated with our new dashboard, that they're going to reach out and encourage and demand that more staff become vaccinated.
Just a quick question about some of like the current state of you had mentioned outbreaks.
Yeah.
Can you give us an example of where things happening in the complex? Serious outbreaks as well.
Sure. So, we actually saw one of our best metrics for the number and severity of outbreaks, in addition to all of the data that we have, are how many requests for support we get. So we get support requests for testing and staffing and rapid response. And between the middle of June and July, we got absolutely no requests. But in the last few weeks, we've gotten 8 requests for PPE, 5 requests for staffing, and 3 requests for testing. And we're happy to help meet these requests. That's what we're here for. But it does give us an indication that these outbreaks are occurring again, and we need to double and triple down on staff vaccination. Because one of the things we learned early in the pandemic is that it's staff who are out, living their lives, going to the grocery store, picking their kids up, all that good stuff, who unwittingly bring the virus into the facility. And getting them vaccinated is the safest and most effective thing we can do to prevent these outbreaks from happening.
I know there's talk about, I think the FDA might be moving forward on the third shot.
Yep.
Do you anticipate the state doing any kind of initiative to work with places like nursing homes where you have a lot of immunocompromised people to get that shot out there to them?
Absolutely, and we've actually already started a lot of that work. So the department is excited to hear from the FDA and ACIP. Hopefully we'll hear from ACIP tomorrow, and then we'll be able to start executing on a lot of the groundwork we've already laid with the facilities. All right, anybody else? Excellent. Well, thank you again, Henry, for hosting us, and thank you all for your time.